I had no ideas about going into healthcare at all originally when I had my first son, and I watched the OB nurses in action. I think that's really where I realized that they impact people's lives so tremendously, and it really got me thinking about going into the healthcare field.
I didn't quite know what I wanted to do. I've always loved science, the body. I've always loved helping people. We have this wonderful community college that has a nursing program, and it just felt like the right path to go.
After I graduated high school, I went into pre-med, and I applied for a job here in the ER as a tech, went to med school, and ultimately went to ER.
So I work in the ER. We get a variety of injuries or illnesses.
So a lot of patient interaction, a lot of behind the scenes coordination with the physicians and the other departments. You're coordinating the labs, the medications, the doctors, you're keeping the family in the loop with everything. So it's very hands-on.
So in addition to working in the ER, I am also able to work remotely from home. I am able to collaborate virtually with other departments and to figure out how we can make the ER and the patient's experience better.
I'm an emergency physician and I do a lot of clinical work, but I also have had a lot of opportunities to get involved.
The opportunities in healthcare are endless. There's so many different aspects, there's so many different job options. You can find a job that fits into your phase of life and your schedule. Whether you want to do the patient care or if you want to do more of the behind the scenes stuff. Either way, everybody has to be here in order for it to work properly and run smoothly, and everybody, whether small things or big things, are helping to impact people's lives and help our community.
There's a huge demand for healthcare workers. Very easy to get a job, and you will become sought after.
No matter what time of year, no matter what's going on in the world, there will always be a demand for nurses.
You can work and live anywhere because healthcare is everywhere.
When I lived in Detroit, you're just kind of in an ocean of strangers. But in West Michigan, you know everybody.
When I was in school, I think I took this area for granted.
It's got gorgeous beaches. There's so much hiking you can do, running, kayaking, boating, fishing.
The small towns in this area really have a sense of community and belonging.
You don't get that in a bigger city.
Depending on where you work as a nurse, there are incentives.
It'll allow you to support for your family and take care of your loved ones. You know, it's a good job.
There are a lot of nursing positions where you can do the Monday through Friday, more of the business hours, which works so you can have your weekends and holidays off. At the hospital here, we do 12-hour shifts for our nurses, most of them. So I get 4 days off a week, which works really well for me and my family.
Anything that you could pretty much think of, you'll probably find a fit, and just right now is a great time to get into this field.
Whether you're an administrator or you're working in the kitchen or you're a nurse or a doctor, you really get to help make a difference in people's lives.
When someone comes into the emergency department, they're a stranger to you most of the time. And this is usually one of the worst days of their life. And then you make decisions and implement tests and medications that have profound impacts on their life, sometimes saves their lives.
It feels good to know that I helped.
I feel like every day that I come to work, I make a difference.